Welcome to read our article, Hemorrhagic Fever with Renal Syndrome Complicated with Rhino-mucormycosis. Case Report. A 40-year-old male was admitted to the Department of Critical Care Medicine with hemorrhagic fever with renal syndrome, HFRS. He exhibited septic shock, decompensated metabolic acidosis, and multiple organ failure. Because of coagulation disorders complicated by left nasal cavity bleeding, the left nasal cavity was filled with an expanded sponge. The second day after nasal filling, the left nasal alar became purple and swollen, Figure 1. Massive nasal necrotic lesions rapidly occurred on the next day. Microbial cultures from lesion samples revealed the growth of mucormycetes, Figure 2. The strain was identified as Rhizopus oryzae complex by mass spectrometry, Figure 3. Sputum culture from fiberoptic bronchoscopy demonstrated growth of Aspergillus. Strains were identified as Aspergillus fumigatus. Thus, the patient was diagnosed with rhinomucormycosis and pulmonary aspergillosis. Systemic caspofungin and voriconazole were administered. The nasal cavity was rinsed with 10 milliliters of saline, kept dry for 1 hour, then filled with a sterile dressing containing 2.5 milligrams per milliliter amphotericin B for 4 hours, and finally with a sterile dressing containing 5% sodium bicarbonate for 1 hour. These procedures were administered every 6 hours. After 12 days, the left nasal scab fell off and a large tissue defect remained, Figure 4. Computed tomography revealed no orbito-cerebral involvement during treatment. The patient recovered and was discharged. During 2 years of follow-up, the patient exhibited no further signs of rhinomucormycosis. Mucormycosis, MCR, is a rare but aggressive fungal disease. Rhino-orbito-cerebral mucormycosis is the most common clinical form of MCR infection, and sinonasal inoculation is the primary site of infection. The morbidity and mortality rates associated with MCR remain high. This case report provides evidence for the successful treatment of HFRS. Thank you for your attention.